Good morning. I'm Nigel Tinsley, and I had a pituitary tumour removed 11 years ago by some amazing pioneering surgery, which made me famous for a day, but left me with adrenal insufficiency. I've learned a lot since then and would like to share it with you. The biggest and most serious problem is that nobody knows about us. We are officially known as a rare disease. I'm sure you all know somebody with diabetes, and it's the most common disease of the endocrine system. It's very unlikely before your diagnosis you knew anyone with adrenal insufficiency. I know I didn't. Unfortunately, this is also true of most medical services. It's quite possible that nobody at your doctor's has adrenal insufficiency. I'm the only patient at mine with it. Your dentist won't have come across it. A&E will know all about diabetic problems, but get very few adrenal crises and might not recognise it. The most important thing I've learned is that we have to know as much as we can about our disease. We have to become what doctors call expert patients. We have to be able to say to our doctors and nurses, I've got adrenal insufficiency and I need such and such treatment. Becoming an expert patient takes some work. You've made a great start by coming along to this meeting today, and you're always welcome to come back for a refresher course. Just check with the nurses when the next meeting is. By all means use Dr. Google, but only use reliable sites. Here are 3 of the most trusted. Just search for any of these on Google and you'll find loads of very valuable information. The most important thing I've had to learn is what we call the sick day rules, which is a bit of a misnomer because you don't actually have to be sick to need them. The sick day rules apply to almost every medical procedure, from dentistry to minor operations and any sort of internal examination. All of these put your body under stress and you'll need to have extra hydrocortisone to help you cope with it. For instance, if you are going into hospital for gastroscopy or colonoscopy, the instructions will tell you all about not eating, etc., but they won't say, and if you've got adrenal insufficiency, let us know, because we aren't on their radar. You'll have to tell them beforehand that you need an injection of hydrocortisone. The same with your dentist if you're having a big extraction. And I'll almost guarantee that when your doctor prescribes antibiotics, they won't say to you, and remember to double up on your hydrocortisone while you're taking these tablets. Always keep a copy of these around so you can show them to your doctors and nurses and dentists, and always check them yourself if you're going anywhere near anybody in a white coat. You might not always be able to tell people of your condition, so it's important that you wear some sort of medical alert. Rubber bracelets are the cheapest, but don't last all that long. I've got a chain with my details on it, which I've had for many years, and it's second nature to put it on in the morning. What about day-to-day management? Remember that we're trying to match the way our body produces cortisol throughout the day, and we need to take our tablets at times that match this. This is what we call the day curve, which you've already seen in Professor Nicky's presentation. The peak for cortisol is around 8 o'clock in the morning, and by bedtime it's nearly all gone, and starts again at around 3 to 4 in the morning. I've found that if I take my first dose at about 6 o'clock in the morning, I can go back to sleep and wake up feeling fine at 7:30. I have my last dose around tea time, 5 o'clock, and have no trouble going to sleep at 11 o'clock. Some people take their last tablet earlier, as they find they're still buzzing at bedtime, but we're all different, so you'll need to experiment to see what the best time is for you to take your tablets. The commonest dose of hydrocortisone is 20 milligrams a day, taken 10, 5 and 5. Your doctor and pharmacy would try and prescribe the cheapest generic make, which is 10 milligrams, then you can have great fun trying to cut them in half. I've never found a pill cutter that really works, but they can prescribe a 5 milligram tablet, and all your pill cutting problems are over. It's becoming worryingly common for some drugs to be in short supply, so always keep a good supply of tablets and don't wait until the last minute before reordering. Doctors are allowed to prescribe up to 3 months supply for long-term conditions such as this, but some are reluctant and it might need a letter from the QE to get them to prescribe more. You will be shown today how to give an emergency injection, and you should always have an emergency injection kit with you. Hopefully you'll never need to use it, but you must be prepared. I keep one at home and always carry one with me. Check the sell-by dates. If you need to use it and it's out of date, don't worry, it will be better than nothing. Handy tip is to keep it in the fridge. It doesn't need to be kept cold, but it's much easier to tell a paramedic that you need an emergency injection which is in the fridge, rather than trying to explain that it's at the back of the kitchen cupboard next to the cat's bowl. What about when you're not at home? Ladies here will have a handbag, but what about us gentlemen? The answer is a satchel or a messenger bag. I've found mine incredibly useful, and you soon get used to carrying it around with you and wondering how you manage without it. This is what I carry around in mine, and there's no way that lot will go in my pockets. It's a safer place to carry your wallet too if you wear it across your shoulders. Here's what you need in your emergency kit. There's a syringe, a bottle of water, a bottle of hydrocortisone powder and a sterile wipe. It's a good idea to have 2 syringes if you can. I've been known to bend a needle when practicing. There's a strip of hydrocortisone tablets in case I'm sick, a letter from the QE about the adrenal crisis, and a list of all the medications I'm on. You'll need to find something to keep them all together and clean, like the pouch I use or a small plastic pot. When you go into hospital, whether as an emergency or for something elective, you need to tell everyone you speak to that you have adrenal insufficiency. If you can't, persuade them to let you self-medicate, as when you take your hydrocortisone, it won't always coincide with drugs trolley coming round. Take any letters and advice leaflets from the QE with you, but keep reminding them all the time, right up to when they wheel you into the operating theatre. I lead a very normal life with adrenal insufficiency, and it needn't stop me from doing anything. The most important message I can give you today is be prepared and be informed. Thank you for listening to me and hope you found this useful.